of the surgical procedure and until the client is being wheeled into the recovery room. So these are the sequences in the operative procedure of the ESWL. Once the anesthetic is given, it is our sole responsibility. Yes.
Oo nga, 2014 tayo dumating dito, ano? Oo nga, 2014 wala tayo.
Yes po. Any question? Ano po yun?
Wala, ma'am. Hindi na na-mute yun.
Okay. Okay. Sige, once the anesthetic is being given or inducted, it is our responsibility to take down the time the anesthetic was inducted and what kind of anesthetic our anesthesiologist given. Then we will strap our patient during the administration of anesthetics because some of them feel like they are drunk or they will fall down on the bed if we will not strap them. And a sequence of shock will be given to shatter the kidney stones. The stones will be monitored by real time by our fluoroscopy or ultrasound during the procedure. During that time, we will just monitor our patients, the vital signs of our patient, and we will render as well any help to our anesthesiologist. Once the stones are fragmented and they are small enough to pass through the urinary system, the procedure will end. Sometimes our radiology technician or technologist can recommend to the urologist that he can see any stones or any shadows. So that's the indication that the stones are fragmented. Our intraoperative responsibilities, we will identify our identify the surgical team and we will know our function. Of course, we will be having the urologist, which is our leader, the anesthesiologist, which is sole responsible for maintaining the relaxation of the patient all throughout the procedure. Our radiologic technologist, the one who is responsible in operating ESWL machine. He must check for the alignment of the machine. He must check for the alignment of the machine to the stone and the alignment of the machine to the patient. And also, he is the one who will command us on what position of the patient in the OR table. We, the OR nurses, we will assure cleanliness in the OR. Though this is not an open surgery, we will maintain asepsis and antisepsis. We will practice that. We will guarantee the proper room temperature, humidity, and lighting of the room. Room temperature for our patient and a good room temperature as well for our machine to maintain its functionality. So that is why we will keep our patients warm because our OR theater or our room is cold enough to maintain the functionality of our ESWL machine. And we will check for that certain equipments if they are functioning safely, just like the infusion pump. If they are functioning, the suction machine, we will check that also. We will ensure that all the supplies and materials are available during the procedures. We will keep track of the time the patient is under anesthesia, and we will monitor the operative procedure all throughout the procedure, the patient's safety and well-being. Post-operatively, it is our responsibility to provide quality care until the patient has recovered from anesthesia. So number one, we will monitor the patient's vital signs. We will protect the airway by giving them oral airway or positioning their heads because during during anesthesia, their tongue might fall down and might cause obstruction. And we will check the level of consciousness during this time. Number 2, we will check the symptoms. Usually, some post-ESWL symptoms, they vary, but some or not all, they are present. They are nauseous and probably vomiting due to the anesthetics given. So we can give them antiemetic right after. There are hematomas or bruising on the site of the procedure. We can apply ice pack for 2 hours to lessen the bruise or the marks. The sleepiness or dizziness, this is a anesthetic symptoms or the effect of anesthesia. Blood tinge or fish wash urine is very common. This is an indicative sign that we are on the right track. We hit the stone, that fish wash urine. And here are some instructions prior to discharge. We will instruct our patients to contact the doctor or us in the reception if they will experience heavy bleeding or bright red color or clotting. Severe or persistent progressive pain not relieved by medications. This is usually noted if the stones cause obstruction or stain stress. If the stone is too big, then if they are flushed in our ureters and cannot pass out, they might cause some stain stress and cause pain and obstruction. Persistent fever indicates sepsis. That's why we give our patients prophylaxis prior to OR, or we are giving them antibiotics ahead of time. Persistent nausea and vomiting. And also we can instruct them that the activities will resume a day or 2, and they cannot lift heavy objects. They should drink a lot of water 48 hours after the lithotripsy. We should encourage them so that they can flush all the fragments, the fragmented stones, and to strain urine and save stone fragments for stone analysis, so that they will know if what kind of stone they have formed in their kidneys or in the ureter, so that they can manage their diet. And that is the end of my slide. And I would leave you this quote, which says, "This too shall pass. It may pass like a kidney stone, but it will pass." This pandemic will pass just like the kidney stones pass using our lithotripsy.
Thank you, ma'am, for an informative lecture. Okay. Is there any question from the participants for the lecture, from the lecture we have had a while ago? You may chat, you may ask your question or post it in the chat box if you have any question. Hello everyone, you can unmute now your mic. Hello everyone, you can unmute now your mic. Okay. Hello everyone, hello participants. Is there any questions that you would like to ask? Hello? So there's
None so far.
None so far. Hello everyone, you can unmute now your mic if there's any question. Okay. There's a question from Ma'am Jesseline. Hi Ma'am Ira. Hello.
Yes, ma'am.
Can we give conscious sedation for the procedure?
Yes, ma'am. Yes, we can give conscious sedation to the patient. But for some reasons, ma'am, we would like them to be sedated so that they will not be moving during the procedure, because some of them are watching the images, and sometimes uh, if they are uh, tawag nito, they tend to be restless actually, ma'am, if they can see what is happening. But if the anesthesiologist wanted it to have a conscious sedation, we can do it, ma'am.
So, is there any more questions from the participants? Hello? So, if there's any no questions may I request everyone to fill out the evaluation in the uh, groups of continuous education unit in our Facebook group. It is already been posted by Sir Fred. And for our speaker, in behalf of the Princeton University Hospital, we are thanking you and we are grateful for your participation as our speaker. And in behalf of Madame Feby Iljan Monye, um, our as associate nursing director, we are extending our heartfelt thanks to you. And for everyone who participate, we thank you for imparting your time in this webinar. So we will announce later on the next webinar. In the evaluation, you can suggest what topics we are going to, you may suggest whatever topics we may have on the next session. So
Questions.
is there any question for the for the lecture? I've heard some sounds.
Hello, ma'am. Sorry.
Okay. Sir Fred, is there anything that you would like to add?
I just want to thank Ma'am Ira, ma'am, personally, ma'am, thank you. Kasi ma'am, nakita ka namin sa ospital namin, ma'am. Nag-rounds kasi ako. Nandito. So thank you so much, ma'am, Mamimi.
Yes. So, sir, can you leave the last parting words for us? So, closing words for us. Sir Fred?
Ako, ma'am.
Yes.
Yes, ma'am. So dito ako para hindi wala naman si Dr. So, I would like personally to thank Ma'am Ira for your time, ma'am. Thank you so much for imparting to us your knowledge regarding the lithotripsy things. There are only few of us who has experience in lithotripsy, ESWL here. To mention, we have the head nurse of the lithotripsy ESWL. We have Ma'am Elizabeth kausapin, and the technician, Mr. Ian, and the rest of us actually would just like to know what are the things in ESWL. We really are appreciating the knowledge that you imparted to us today, ma'am. So, in behalf of the Prince Atam bin Abdulaziz University Hospital, we thank you from the bottom of our heart, ma'am. Thank you so much, and I guess si Sir Ian na bahala sa iyo, ma'am, regarding mga inana. So, in behalf of also of our nursing director, Miss Phoebe Iljan Bunyi, maybe Ma'am Phoebe is here, and nursing administration, office. We thank you so much, ma'am. So that's it. I think Ma'am Mimi already had discussed to you about the evaluation. I think we had posted it in our group. Kindly complete that one for all the participants. Thank you also. That's it. Thank you so much. Good afternoon. Nagpicture na mo? Nagpicture na? Mo nagpicture?
Don't leave, don't leave, don't
Nag-leave
leave.
siya.
Don't leave,
Picture
Ayan,
pa.
ayan. Picture mo na, picture.
don't leave.
Screenshot no, ma'am. Picture din na. Dire ko supervisor's office. Picture daw, ma'am.
Picture.
Okay, wait. 1, 2,
Ano?
3, 4.
Yan.
Another one.
Open mo na lang camera ba?
Ay na, mami.
Okay. Thank you very much, everyone.
Kami po,
Thank you so
mami.
much, Ma'am Ira. Bye-bye, ma'am.
Bye-bye.
Thank you.
Good night.
Good night, Diha.
Good night mo.
Good night. Naro! Saan na to?
Ano?
Meeting for all.